4 world-class trialists on the magic of randomisation, the context of observational studies. However, because of the potential biases inherent in observational studies, such studies cannot generally be trusted when, as is often the case, the effects of the treatment of interest are actually null or only moderate, i.e. less than a twofold difference in the incidence of the health outcome between using and not using treatment. In those circumstances, large observational studies may yield misleading associations of a treatment with health outcomes that are statistically significant but non-causal, or that are mistakenly null when the treatment really does have important clinical effects. Instead, randomised controlled trials of adequate size are generally required to ensure that any moderate benefits or moderate harms of a treatment are assessed reliably enough to guide patient care appropriately. The magic of randomisation is that it is guaranteed to result in groups of patients that are balanced, give or take the play of chance, with respect to both known and unknown risk factors, regardless of whether those risk factors have been assessed, and hence with respect to their risks of any type of health outcome. Part of the drive towards using non-randomised observational studies to assess the effects of treatment comes from the current costs and complexity of conducting randomised trials. During the last 25 years, there has been an enormous increase in the rules and related bureaucracy governing clinical trials. There is now an urgent need to develop comprehensive guidelines based upon the scientific principles underlying randomised controlled trials that focus on those aspects that really matter for both generating reliable findings and ensuring patient safety, and that take advantage of technological advances to increase the scope of randomised evidence. MoreTrials has brought together over 260 leading trialists from 35 countries, along with the support of over 40 organisations, to develop such a guideline.